Okay, today I'm here chatting with Dr. Kate Barry, one of our main sponsors here at Sanctuary, and we're going to find out about how amazing she is and why she felt the desire to help the Sanctuary project get underway. So to begin, welcome, Kate. Thanks for joining.
Hi, thank you. Thanks for having me.
That's okay. I'm excited to get to know you a bit better. So let's dive right into it.
Sure.
Now, you have an impressive long list of career achievements. You've undergone a PhD and doctorate in biology and a Bachelor of Science. I understand you also teach science at Macquarie University. You're a functional nutrition counsellor and lifestyle practitioner, certified health and life coach. It sounds like you have a lot of knowledge and skills under your belt. Can you let us know what it was that actually led you to be doing the work that you do at your holistic health and nutrition practice?
Yeah, sure. So I guess, unfortunately, like many other practitioners, it was a personal kind of health crisis that led me to starting the clinic and trying to help others with kind of chronic health issues. I was very happy and kind of successful in my science career. But in 2016, I kind of just started having these random symptoms and I became quite ill, seemingly kind of out of nowhere, and I'd been really healthy up until that point, and it kind of just took me by surprise and I really had no idea what was going on. A lot of neurological symptoms, fatigue, brain fog, numbness, tingling. And yeah, it was a really scary few months. They thought it might be MS for a little while. And and as I'm sure maybe for yourself and other people, you've heard the story of then going around to lots of different doctors trying to figure out what's going on.
Shelling out all the money.
Yeah, lots of money, lots of different specialists. And yeah, look, the specialists were actually quite good and quite helpful. Which is different to what I've heard a lot of other people talk about. They couldn't tell me what the problem was, obviously, but they were very helpful. They were trying, whereas the GPs, it was a bit of a different story. It was kind of hard work to get them to believe me. And so, yeah, it was a stressful couple of years trying to figure out what was going on. And, I was obviously getting sicker and sicker during those couple of years. And finally, in 2018, I guess just through a little bit of reading, I was reading a lot about diet and lifestyle to see if I could, shift things myself.
Yeah.
And I came across this idea of, this term functional medicine. And so I Googled it. I found a functional medicine practitioner in my area. And that's when things started to shift. And, this suggestion of mold and biotoxin illness was brought up, and things started to progress quickly then, and everything kind of was light bulb moments, of like, oh wow, okay, this is what's going on. This is definitely the problem. And so, I started treatment, very slow recovery, lots of ups and downs over the following kind of couple of years. But then, I guess in around 2020, it became clear to me after learning a lot more about mold and, the effects, that working at a university as I had been was really going to be impossible because, I mean, you can probably imagine most universities are very old buildings.
Yeah, they
very
are.
Damp. Very damp.
Yeah.
Very, I mean, you just think of especially the oldest, all universities, but especially the older, sandstone, lots of flooding had happened at universities that I'd been at. And so, I just kind of decided, look, I need to do something else, that this isn't going to work for me anymore, unfortunately. And so I just kind of felt a bit of a calling to, to try and move into this health space and help other people that maybe were experiencing some of the same issues. And so, I initially trained as a health coach, but then I tried to take it a little bit further with functional nutrition and lifestyle, work. And decided to open an online clinic.
That's awesome. I guess for many people who end up going down this field, that they've experienced it themselves, and you can't go through this without wanting to, turn back and reach a hand out to the other people who are coming up through just figuring out what's going wrong with them.
Absolutely.
And
Absolutely.
yeah, it sort of forms this
I think
little
especially with this kind of situation, right, where it's so kind of unknown,
yeah,
you
and
know, like
so
a lot of people
extreme.
really have no idea that this is a problem.
Yeah. And I think
Yeah.
also that dismissal that happens in
Yes.
society, it makes it, you know, there's even more of a need for people to stand up and say, oh, this is real. Let's
Yeah.
help you through this.
Yeah.
So like
Absolutely.
good on you for turning this into such a positive in your life.
Thanks.
And I saw on your website that your holistic healing plans take into consideration the 5 pillars of wellness, you call it. Can you elaborate on that and how it's all interconnected? As that's not something that is really factored into when you go see a regular GP. But I know, like many of us in the chronic illness world, find out just how interrelated these 5 areas of life are and the drastic impact they can have on your health if they become unbalanced.
Yeah, sure. So the 5 pillars of wellness are kind of I think most people would agree on these 5 pillars. They're kind of basics or the basis of health and wellness in a way. So the 5 things that I kind of include here are nutrition and hydration,
Yeah.
exercise and movement, sleep and relaxation, stress management and resilience, and then kind of relationships and connections. And I just find that, you know, these are the really, as I said, the basis and the things that you need to build on with respect to health and wellness. So obviously sometimes you need to take it a little bit further, but you really need to focus on these first and foremost to get an idea of, you know, what you can move and how far you can move the needle just with these basic you know, protocols. And so I guess the way I like to explain just how important they are is using this kind of tree analogy.
Yeah.
I've actually got a cute little picture on my website to describe it too, where you look at you think about I think most people understand this analogy of the roots of a tree being like the roots of chronic illness.
Yeah.
And then the branches are any sign, symptom, diagnosis that you may have. So essentially these branches are kind of downstream effects of what's happening at the root level, right? Now, the roots are generally things like the gut health and inflammation are the 2 big ones, probably genes as well, maybe a third one. They're the 3 roots that I talk about often. But what we kind of often don't talk about in that picture is the soil and how important the soil is in nourishing those roots in the tree. And the soil, in my opinion, is these 5 pillars of wellness. And so you can imagine that, you know, if you don't have that nourishment in the soil with the nutrition, the sleep, the hydration, all of these things that are really important, then these downstream effects at the branches can be really significant, both positively and negatively, right? If you actually nourish them, you can have really positive change. And if you don't, you can have really negative outcomes.
That I really love that analogy as a green thumb. That's lovely.
Well, it makes a lot of sense, right? I think because
Really
I think a lot of people realize how important soil is for plant growth and tree growth. And so, yeah, I think it's a really good way to explain it.
Yeah, love it. And so can you talk a bit about how you approach working with each client as a functional practitioner? Do you do much prescribing of supplements to support the body, or is your approach more nutrition focused? Like where do you sit with that?
It's both, actually. So I try and use as many tools as I can. So I can prescribe supplements. I obviously use nutrition as a big one since I'm a nutritionist. And lifestyle factors, as I mentioned before, the sleep, the stress management, all of those things. I think it's all important. And in terms of an approach, I guess my general approach is focused on what I call the 5 C's, which is to create, care, calm, clear, and cultivate. And so create is about really the 5 pillars of wellness, but it's just a different way of putting it. So creating a kind of anti-inflammatory diet and lifestyle protocol. which, can have lots of commonalities between individuals, but is also targeted at particular individuals and what their body needs, whether they have deficiencies, whether they have intolerances that we need to talk about. Care is about caring for the gut.
Yeah.
Calm is about calming the nervous system, which is often a big component of chronic illness, and particularly mold illness, where the nervous system is overactive and is kind of preventing recovery or full recovery. Clear is about clearing toxins, which is obviously a big piece in mold illness. And cultivate is about cultivating body awareness, which I think, again, is really important for, particularly in mold illness, and recognizing the signs without being obsessive, I guess.
It's a fine line, yeah.
It is a fine line, it is. But yeah, I think even without the mold piece, just being aware of what your body's telling you. And, I know myself, when I suffered from chronic fatigue, it was very important that I listened to the signs of, whether I'd, where the line was, where I really had to stop. Otherwise, I would suffer significantly in the following few days. So, yeah, the cultivate part is really an overarching theme. It's not like the fifth step, if that makes sense. I'm trying to teach that the whole way through.
Yeah.
But yeah, I really think that the length of time that we spend on each really depends on the client and their symptoms and their root causes. So, for example, with mold, obviously the clear phase is going to be quite important. But that doesn't take away the need for the create, care, and calm phases beforehand, because what I find is one of the biggest kind of issues that I see is that people are going straight to detox, and with a body that can't cope with detox right now, if that makes sense. So, building up resilience with those 5 pillars of wellness and doing a little bit of gut work and nervous system work can be really effective in helping with that detox. But yeah, for me, I guess the idea is to work simultaneously on those basics while also investigating root causes. I think that's the most important thing. Don't just try and, minimize symptoms, but figure out why the symptoms are happening in the first place, which I think is a big something that's missed a lot.
Absolutely. Yeah. I know in my own journey, there was decades wasted of just Band-Aid treatments. And it was only once I figured out the core issue that I was able to finally start, getting better.
Absolutely.
I kind of wish that I had have had the guidance of someone like you, because at the start there, I was very gung-ho, like, right, I'm going to get these toxins out. I'm just going to go. And, and I've had friends do the same, where they've just taken all the meds and done all the things and trying to flush it really quickly and gotten really sick and had really, this collateral damage.
Absolutely.
So it's important to get in touch with what your body's trying to tell you.
It is.
Before you begin.
And it's hard to, I think, coming at it from a patient as I was, and the same like you're talking about for yourself. You just want to feel better, right? So you kind of just want to just jump to that final stage.
Because you're like, finally, I figured it out.
Yeah, that's right.
And then, you just want to be better and get your life back. So it is very hard to pace yourself.
It is.
But yeah, it sounds like a really nice approach that you take. And now I know like COVID changed a lot for people as they started receiving services online out of necessity, but also like personally, through my own journey with CIRS and mold sickness, I was so reactive to so many environments, and I struggled with travel. So I actually started seeking practitioners via telehealth, and Zoom is my preference anyway. So I think it's that it's really great that you're able to offer your services to anyone, anywhere, because this can happen throughout the country. It doesn't matter what climate you're in, people get mold sick. But I imagine there are some challenges that come with working with patients online. How do you get around those challenges?
Look, to be honest, I actually don't find any challenges
Oh,
with
really?
working online.
Yeah.
I don't. And I didn't open like an online clinic because of COVID. That was always my intention.
Yeah.
And I think it came from, again, being a patient myself
Yeah.
and just really struggling to be able to make my doctor's appointments and my practitioner appointments, whatever they were. I mean, I think it's obviously a little bit different when, you know, there's physical
Like if it's a
examinations
skin rash or
or
something that needed to be,
yeah,
yeah.
yeah. I mean, it's a lot of the time it's good enough to be able to see it on Zoom. Like people will show me things on Zoom,
Yeah.
and it doesn't need to be. Yeah, I don't need to see it in person.
Yeah.
You know, and I'm not doing any kind of physical examinations like medical doctors might do. And
Yeah.
obviously, with things like chiropractors, it's you know, you
Very
obviously
hands
have to
on.
be there in person.
Yeah.
But yeah, for me, it just makes everything a lot easier in terms of not having to travel, you know, energy issues. It's much easier. And you mentioned the environmental issues too. You know, it takes quite a lot of time and energy to find a safe space that you
Absolutely.
can actually go and, you know, and then a lot of maintenance, right? To be able to be there for myself, but also to be kind of confident enough to bring other people with environmental issues into that space. And so I just find the online space kind of gets rid of all of those
Yeah,
issues. Yeah.
that's awesome. Yeah, I'm really glad that you don't run into challenges like yeah, super happy. um so where am I know it's hard when you're chronically sick to know where to turn for help, and many of us end up with a bit of medical PTSD from all the gaslighting and the dismissal. Definitely know I've got that, and all the
Yeah.
wasted time and money heading down dead ends. So having a practitioner like yourself who has experienced the journey of CIRS and you know, all the cascade of symptoms that come along with it, and the immune dysfunction, and have actually healed, or, you know, I guess to what degree do you say you've healed, but you know, you've
Sure.
come out the other side, I would say healed. So it's going to make people feel confident in seeking out your services, but it can still be quite expensive going down the functional health route with none of the Medicare rebates. Can you talk about your success rate with clients, just so that anyone considering this investment in their health can know how likely it is that this investment will pay off when so many others haven't?
Yeah, sure. So I'll talk about it in two different ways. So
Yeah.
talking about in terms of clients with chronic illness that isn't driven by mold or as the main kind of issue. So a lot of people come to me with autoimmune conditions or gut issues. So I'd say I'd have close to 100% success rate there. The reason I say close to is because there are a couple of clients that, you know, just, I guess, feel like many of the changes are just too much for them and their lifestyle.
Yeah.
And they find it really difficult to make dietary changes, especially when, you know, you're cooking for other people in the household,
Yeah.
that kind of thing. And so obviously in that situation, you know, people aren't going to see the improvements that other people will when they do stick to these kind of anti-inflammatory type style protocols.
Yeah.
I've had many clients with autoimmune conditions go into remission. You know, had many clients with migraines that don't have migraines anymore.
Yeah.
Chronic, I guess, degenerative neurological conditions. I've had lots of clients where, you know, symptoms have either stabilized or even improved slightly. So yeah, lots of really good outcomes from that perspective.
Yeah.
In terms of mold related illness, which is obviously often a more complicated beast,
Yes.
and can take a lot longer. You know, I've had dozens of clients that have completed kind of 6 or 12-month programs with me.
Yeah.
And I would say all of them have had improvements. Many have had significant improvements, and it really depends how far down the recovery, you know, track they are, or because, you know, some of those clients are only just getting started. Some people have more significant results or, reduction of symptoms simply from, dealing with those 5 pillars of wellness, like I said, and a little bit of gut work. Some people have significant results based on the nervous system work. So it really depends on the person. But I can say that I would say everybody that I've worked with has had some sort of improvement, and it just really depends, how long you've been at it, because it is, it is a marathon, not a sprint. And like so it can be quite a slow process,
and such a complex one. I mean, if you don't find the right safe environment, then
that's right.
You're constantly taking on more toxins, and so you can be doing all the right things.
That's right.
But
and I really do try and make that part of, like, I don't ever say no to people that really need help, but trying to get that across before I even take them on as a client is really important, right? Like, you're going to be kind of wasting money if you're trying to treat this without moving or remediating. So you really need to figure that part out. So I do try and support people in that first, or at least simultaneously with working on the 5 pillars.
Because I guess there's still things you can be doing to help yourself if
absolutely
you're in a toxic environment, but it's sort of like
that's right.
driving a car with the brake on. Like, you're not gonna really get very far, and you're gonna cause a bit of damage at the same time.
That's right. Absolutely.
All right. Well, I mean, that sounds super positive to me. And I mean, just in getting to know you, it's sounding like I wish I had your care from the start. I might take it on now. But now, coming back to why we're actually interviewing you today and how we've come in contact with each other. So you've been a major sponsor for Sanctuary. What was it about the Sanctuary project that made you feel the desire to sponsor us and help us get it up and running?
Look, I think it's a really great idea. My partner also suffers from CIRS, and we've had many conversations over the years about, having some kind of space. I guess we were talking about it in terms of a physical space, but an online space like yours is obviously much easier. And I just think it's a great way of, getting information to people while also facilitating this space where people can connect, because it's such an overwhelming. I remember when it first happened and I first found out that it was mold, and you start thinking about having to get rid of all of your belongings, and it's your home, and it's so overwhelming, and just exacerbated by the fact that everyone thinks you're crazy, right? Nobody understands why you're throwing all your stuff away and why you're moving or whatever it is. And so having a space where people can find each other easily, and also kind of get more information from practitioners and things like you're trying to kind of, set up and increase over time if possible. I think it's just a great idea, and I'm fully on board, and just thought I really need to support this.
Thanks, Kate. That's amazing. Yeah. And I envisage, like, you and your partner to actually have a safe physical space, because wouldn't it be amazing if in that time where you found out that it is mold, that you could just walk out the door, go and stay somewhere that is safe for a month, and be coached through the next steps, and then get your brain back to be able.
It's a game changer. It really is. It's a game changer.
Yeah. So that's where I'm aiming for, but starting really slow.
Baby steps.
Baby steps. And like, it's so important to have the support like yours to help it along. So, and it is slow because I'm still healing myself, and so I have to pace myself. I know I've got to catch up on some promises I've made very shortly, but no, it feels really good to get the support from other people like yourself. And I guess we'll finish up with possibly a tricky question. What's the
Uh-oh.
what's the most important or valuable thing you've learned in your journey with chronic illness that you wish you knew at the beginning?
Well, there's probably a couple of things. The one that jumps straight into my head is don't underestimate the effect that mold can have on your body.
That's fine, yeah.
is the first one. But more generally, I guess, I think I mentioned it before, like it's a marathon, irrespective of what the chronic illness is, and, you know, trying to kind of recover or go into remission, whatever kind of term you want to use, depending on the condition. It's definitely a marathon, not a sprint. Recovery doesn't happen in a straight line, I think, is another good one, because you kind of just assume at the start that you're just gonna, if you do get better, that it's just gonna be, you know, linear, right? And it's definitely not.
Roller coaster.
Absolutely. And in saying that about the you know, it not being a straight line, I think another thing that I've learned is that you really need to be kind and patient with yourself. I think at the start it can be really easy to kind of, you know, get really frustrated and not ask for help and kind of get stuck in that, you know, in the bad stuff, in the negative stuff, and think that it's never going to get better. So I've learned to just be on those days that you're not doing well, and not kind of, you know, think too much about it, because otherwise it can be easy to kind of go down the rabbit hole, and then just focus on on the good days and the overall progression, I guess, rather than what's happening on any one day.
Yeah, amazing. I mean, those are like true to my heart too. Those are the things that I would pass on. So awesome. Well, thanks so much for chatting with me today, Kate, and
no problem.
thanks again for your generous support of Sanctuary. It's like so appreciated, and it's been lovely to get to know you.
No problem. My pleasure.